Now back to your Royal College exam world, where they're going to ask you some short answer questions. So what they typically show you is a picture of a human being as such. Okay. Now, what they'll say is that, hey, if you have a port that's kind of pointing straight towards your glenohumeral joint, what nerve is the most important to block? And the consensus document, which we go by, is you will have to answer the suprascapular nerve, because that supplies the 70% of your glenohumeral joint. Now, if they turn around and ask you, okay, now the port is inserted behind, okay, into the cape of the shoulder, and what nerve is most important to block, then the consensus document says that you would have to block the supraclavicular nerve instead. Okay, so that's kind of the two tricks. Now, I just want to point out the fact that the supraclavicular nerve and the supraclavicular brachial plexus block are two different things. So when you say supraclavicular brachial plexus block, you are referring to the blockade at the kind of trunk level, whereas if you are talking about a supraclavicular nerve block, then you are blocking this specific nerve that supplies the cape of the shoulder. Similarly, if you are doing the axillary brachial plexus block, then you are blocking the brachial plexus at the branches area. Whereas if you are doing the axillary nerve block, then you are blocking specifically the axillary nerve. So these are some important differences.